In the meantime, it is the 15th of the month, and that means we are talking about your heart health. And you know what? When it comes to your heart health, knowledge is power, especially when it comes to prevention. Mayo Clinic Cardiologist Hari Chaliki is joining us this morning to talk about diagnosing and treating aortic stenosis. So it's good to see you here, Dr. Chaliki. Thank you for coming on.
Thank you very much.
First of all, explain to us at home. I think I know, I've heard the term, what exactly is aortic stenosis?
As you can see, I have a heart I'm holding. When the blood gets out of the heart, it needs to go through a valve before the oxygenated blood can come to your rest of the body. And so that valve is called aortic valve. It's right here.
It's this valve right here.
Yes.
Let's turn it that way. There we go. And then we're talking about this right here.
No, underneath.
Oh, underneath?
Yes.
Okay, way down in there. I don't know if you... Oh, okay, I can see that now. Okay. What actually causes aortic stenosis, and what does the term aortic stenosis mean? Does it mean a hardening?
So the aortic stenosis means it's a narrowing of the valve. So when the blood is trying to get out of the heart, it goes through a valve called aortic valve, but if it is narrowed, it's called aortic stenosis.
What are some of the symptoms that we would know or experience if we had our aortic stenosis?
So what causes first is a calcification, and if people are born with two leaflets, so that can also over time can calcify and cause aortic stenosis. The symptoms could be no symptoms when it first starts, but over time
you won't even know?
Yes,
wow.
But over time it can narrow. But once it reaches a certain narrowing level, then it can cause symptoms such as chest pain, shortness of breath, or passing out spells. And occasionally people can even suddenly die because the valve gets so narrowed. Oh my gosh,
which is why you're here to help prevent that. Okay, let's talk about some of the diagnosis. And first of all, let's take a look, if we can, up here on the monitor. We have, you call this a normal valve.
Yeah, it's a 3 leaflets and it's a normal valve.
Okay, and what makes that normal? It looks healthy to me, the untrained eye.
Yeah, so with echocardiogram we can see 3-dimensional picture of a normal aortic valve. It has a normal 3 leaflets. The opening is normal. We also measure different things to say it is normal in terms of blood velocity and mean gradient and those sorts of things.
I'm sure. And this is a test that is required to find out if you have stenosis to begin with. Let's talk about the bicuspid valve. What are we looking at here?
Some patients are born with 2 leaflets instead of the 3 leaflets that most of us have. It happens about 1 in 100 chance that this can happen.
Oh, really?
It can run in families. So they have 2 leaflets instead of 3, as you can see. So it can cause narrowing a little sooner than the other valve that we're talking about.
Okay, and the last one is the narrowed bicuspid valve. The second one we looked at must be like a genetic disposition. What is this one cause?
Yeah, this is the same genetic abnormality that caused the bicuspid valve, but over time calcium form on the valve and makes it more and more narrow, and a lot of people need surgery for this at a younger age than the other kind of valve disease where it takes longer for the calcium to build up.
And here's what is something so amazing to me. I'm going to hold this in my hand, and Jeff, I'm going to let you get a shot of that. I had no idea, Dr. Chaliki, this is an actual valve that you would put in someone's heart. I'm surprised at how big it is.
Yes. So not me, the cardiac surgeons will put that in. So a lot of people need surgery if it is bad enough. So they replace with sometimes a tissue valve like this one. And some of them, like this one, is made out of cow pericardium, the sac around the heart. They'll make a valve out of that.
Unbelievable.
And some are metal valves, and some nowadays we can even do it with a catheter in certain patients where we can replace the valve.
Well, you know what, and as we always say, it is always about prevention. we want to make sure that you just don't get to that point where you have surgery. So, of course, if you'd like any more information about Mayo Clinic and about aortic stenosis diagnosis and treatment options for you, call this number 480-301-8200. And don't forget that ABC 15 is teaming up with Mayo Clinic for the Rally for Red campaign. Each month, we'll give you easy-to-follow recipes and ideas to help keep you and your loved ones heart healthy. To learn more and get our Rally for Red reminders, sign up at abc15.com/rallyforred. Thank you, Dr. Chaliki.